worrying about everything else to take up a bill when we got sick at work. So I had to go out, find out where I had to go to get tested, drive the hour to get tested, waited, and get all this medication that I have to take right now just to keep myself. Yes.
Tanya, I know this is a very powerful story, and I want to let other people speak too, but if you stay on, I'm sure we'll have an opportunity for discussion after the senator gets off. I didn't mean to go off. I'm sorry.
No problem. Thank you for listening.
Hey, Rick, can I just ask Tanya a quick question before we go to the next one? Tanya, do you have any, while you've been out, have you had any pay or compensation while you've been out?
I spoke to her about that the first weekend. It is our responsibility to use our vacation times, our sick time and vacation time. And I just do not think that is fair. So that's why I sent her the information about the Family First Coronavirus Act. And she said, we're not covered under that because they're a private sector. And I just don't understand that. If we are the nursing home workers, why are we not covered under that plan?
Mm-hmm. Okay. All right. Thank you. Thank you for that story. That's incredibly powerful.
Thank you for listening.
Thank you, Tanya. I think next we have from CSEA, Queen Freelove. Queen, are you on the phone? I think you are. If you want to hit unmute.
Can you hear me?
Yep.
Okay. Good afternoon, all. Senator Chris Murphy, thank you for taking the time to listen to us today. Let me get right to it. The effect that this is having on providers, we cannot make ends meet right now. Plain and simple, we can't make ends meet. When the PPP came about, when providers applied, because they told us we had to wait, the money ran out. So only big companies were able to apply and be compensated. There was no compensation for us. So with that being said, no money. If you had a daycare with a substitute or employees, we had to let them go. We let them go with no money because there is no money. In small in-home and small centers, we're not staffed to where we have a lot of money that's built up. There is no built up money. It's basically paycheck to paycheck. So we had to let them go. Of course, they can collect unemployment. However, we all know that unemployment is backed up. So what that leaves for providers is food lines. And the food that you get out of the food lines is really not food to make a meal with. There is no meat in that. So we get protein, you get the yogurt and you get the peanut butter, but that would be about it. We depend on the state, OEC, for cleaning supplies. Hopefully the first round of that is gonna start tomorrow. So we're now depending on family, the state. So let me bring this back to you. This is why we are going to also depend on you. We stood by you. We need you to stand by us. We need you to get us some money. We would like to keep our daycares open. Childcare providers are first line people. The nurses, the doctors, they cannot get out there and work with young children if they don't have anyone or family to care for those children. We take a risk by taking care of their children because we know that they're on the front line and they're taking a risk. So we're all taking a risk right now. So I say to you, help lessen the blow. Help us be able to provide those cleaning supplies that we need, the masks, the gloves, the aprons. We need those things too, and we can't afford them if we don't have money, because the state is not going to supply us with everything. You know, they say God blesses the child who has their own. So we have to have some things on our own, but sometimes in life, we have to depend on others. We're depending on you. So we are stand-up people, and we already know that you are. So we want to put you to work so that you can keep us at work. Thank you for your time.
Thank
Queen,
you.
thank you. Queen, thank you for that. Just to let you know, about a week ago, the Republicans wanted to put another $250 billion into this PPP program, the one that you're talking about. And listen, $250 billion is a lot of money. It's a lot of money. And we said, listen, we're hearing stories like yours. We're hearing that the businesses that got these grants were the businesses that had the big lending relationships with the banks, and the small businesses, the minority-owned businesses, the businesses that might have had a checking account with a bank but didn't, have a big loan with the bank, weren't getting the money. And so the reason why this has taken so long is because we demanded that there be specific money put into the second round to address situations like yours, that we reserve a portion of the money for very small businesses, for businesses that don't have complicated banking relationships already. And hopefully, like I said, we're getting on the phone at about 1 o'clock to see if we've been successful in getting that set aside money put in there. But 100%, that's what we've been fighting for the last week, is to make sure that, small operations like daycares have just as good a chance to get this money as a big restaurant chain.
Thank you for continuing to fight for us. Thank you so much.
Thanks, Queen.
Thank you, Senator. Thank you, Senator. Next up, we have Danielle Woods from 32BJ. She's a security officer. Danielle, are you on the call? If you are, unmute yourself. Go ahead.
Good afternoon. Can you hear me?
Yep.
Okay. Good afternoon, everyone. And thank you, Senator Murphy, and everyone on the call. My name is Danielle Woods. I'm a security guard at DSS New Haven. It is difficult during these circumstances regarding the coronavirus. We haven't had any personal protective equipment. We just got it yesterday. I realized that other essential employees and also SEIU are still without PPE. They need it. I needed it a long time ago. I have an underlying medical condition. My daughter has an underlying medical condition. She has respiratory issues. Last week, the state closed down because they had an employee infected with the coronavirus. This week, they reduced hours. So we all are full-time employees. There's 4 guards that work to that building. One guard will be working 40 hours. He's a supervisor. It's another guard who will be working 32 hours. And me and another guard, our hours are reduced to 24 hours. I commute to work. My commute is 2 hours, 1 hour to work and 1 hour from work. So now I'm being reduced. I'm a part-time employee. I no longer qualify for medical. How am I going to get my medical? My whole family is under my medical. I need to take 1 pill a day for my condition. How is that possible now for me to do all that? I go to work, or I have been going to work all this time, risking my life and the life of my kids also. I ask you to help us and help everybody else who are becoming
You're muted. There you go.
Can you guys hear me now?
Yeah.
Yeah, we can.
I just asked for some type of help. We're putting our life at risk. We're putting our family at risk. Something has to give. We are considered essential employees, but essential employees with what? With no benefits behind it. Is just the title as being essential employees. Risking our life and risking our family lives. We need help.
Thank you.
Well, thank you for that, and you're bringing up a really important issue here, which is that we talk about the unemployment benefits being extended. Well, that doesn't fit your situation. You're still employed. You're just not making enough to make ends meet and to be able to afford insurance. And it's why we want this additional payment to be made to every frontline worker, and we want that definition to be broad so that it covers security professionals as well. We made a very bold proposal. A bunch of us got behind a proposal to say that every essential frontline worker who's putting their and their family's health on the line should get a $25,000 bonus. Now, that's a lot of money. We know that maybe our Republican colleagues won't agree to that, but we wanted to start big because we know that people are going to have additional expenses. For you, it may be healthcare. You're going to have to go buy healthcare through the insurance exchange. You're going to have to pay a premium for that. So we're going to fight really hard to get that payment for frontline workers, and we're going to fight hard to make sure that it's expanded to cover everybody that's putting their safety at risk. I appreciate your story, and believe me, we're fighting for you.
Thank you.
Great. Do we have Catherine Nadeau on the line? Is Catherine on? I didn't see you in the list. No? Maybe we could go to Tawanda Kitt, who works at DOC. Is Tawanda on the line? If you are, unmute yourself.
Hi, yes, I'm online. Good morning, all. Good afternoon, all. And Senator Murphy, thank you for your time. My name is Lieutenant Kitt. I work for DOC. I oversee inmates, correctional staff, and I am a primary responder to every incident that occurs along with my staff. We are working day and night and are subjected to dangerous conditions in the prison. We cannot practice social distancing. It's hard when we're responding to fights and assaults. We may not have the mask on at the time or at the moment because that is not our normal. We are just running and we're trying to save lives. Until recent, we did not have proper PPE in our quarantine unit that houses the inmates that have tested positive and are waiting for their results to come in. We did not have tie-back suits or face shields. We were told that correctional staff doesn't deal with inmates at that same manner or the same capacity that the medical staff deals with them. But when you are in the unit for 8 hours, touring, answering questions and dealing with these inmates, you are exposed to all the same air in the close quarters. We have put plastic bags on the windows that the inmates interact with us to try to prevent exposure. We are hazardous duty. I know we're hazardous duty, but we didn't sign up for this. It's even more dangerous with the pandemic. Inmates too are stressed and angry. They want to go outside, but are not allowed right now. They are not allowed to go into the dining hall to eat because of the social distancing. So they are getting cold meals majority of the time. And inmates are forming alliances with each other, making a stand. And it's becoming a dangerous situation for all of us to be put in. I am very appreciative that staff has committed and are continuing to come in, but there is staff who are getting sick and worn out. We went into emergency staffing sometime last weekend, and we had to shut down posts. We didn't have enough staff to run the facility effectively. With that being said, we are at a higher risk. Staff are mandated to work double shifts. People are getting worn out, and we are only as strong as our weakest link. Let it be noted that we appreciate the agency for providing the PPE that we have gotten, but along with things going on, issues perspiring at home and then going into work, it can become overwhelming. And that's all I have to say. And I thank you for listening to our call today.
Well, thank you. Thank you for what you're doing. And, we're pressing this administration to take control of the manufacturing of personal protective equipment, because the thing we're hearing from all of you is that you don't have what you need to be protected. And this issue of getting worn down is one that I just hear more and more and more of. There's only so much that you can take being in a crisis environment every single day. It's another reason why we've got to, get some compensation out to frontline workers, but also have some incentive packages to hire more, to get more people in. Now, obviously, you can't become a corrections officer overnight, but there are other positions where we can try to get some reinforcements in sooner rather than later. So thanks for that story.
I'd like to squeeze a couple more if we can. I believe that Kat Nadeau is on the line now. If you can unmute yourself and go quickly. Go. Kat, are you there? Okay. Is she there? Why don't we try Alberto and then Kat can come on. Alberto, you had your hand up?
Yes, I just wanted to appreciate what the Senator is doing. I remember when you came out basically angry for what was going on one of the meetings early when the President Trump was denying the gravity of the virus. Again, Local 32 BJ represent workers that are on the front line of the pandemic. One of our members mentioned a few minutes ago the fact of many people continue working with reduced hours and losing their health care. Danielle example around in our union right now. And we're going to be appreciative of the help that you can provide in that regard. Thank you for being with us today.
Great,
Thanks.
thanks for your comments.
Let's try Kat again. Let's see if she could get on. No? Yes? So no? Okay, how about Claire? Claire, can you unmute yourself and speak? Claire Martin? Are you there? Unmute. If not, let's one last try. Laverne, is Laverne Hatcher there? Yes, unmute yourself. Go ahead.
You can hear me?
Yep.
Okay, hi everybody. Thanks Senator Murphy for taking this call today. I am a group home worker, and along with everybody else that spoke earlier, what we want to do is be put along with everybody else that's concerned of frontline workers, essential workers, because we work in group homes where we cannot do social distancing. It's hard to do because our people have behaviors. We haven't got our proper PPE. Now they are giving us hazard pay, but to me, my life is whole a lot worth than $2 an hour extra. I just found out today that one of our individuals tested positive. And in the memo I got, they said they're gonna pay you $2 an hour extra for hazard pay, plus an additional $3 an hour extra if somebody is diagnosed with COVID and you have to work there. These are our lives. And we have to go home to our husbands and wives and children. And this is scary as hell. And $5 an hour extra is not worth my life. But we go in there every day and we do our jobs diligently. So what we're asking for is for you to help us, put us as one of those essential workers, like you were saying in regards to getting the $25,000, which we know probably not gonna happen. But we also want you to see if you can help give us more funding for DDS so that we can get the proper PPE, because we don't have that yet. We just got our thermometers. I was also told that somebody heard a nurse telling them, okay, we don't have this stuff, so wear a garbage bag. Really? A garbage bag? Come on now. That makes no sense. So these are the things that we're looking for. We also want to see if we can get more funding so that our sisters and brothers that don't have insurance can get help and free testing in regards to COVID. This is what we're looking for as home care workers, and we need their help desperately. And also, the other thing I just want to put out, the stress levels is just unbelievable. DDS put out that we cannot get vacation time, we can't get laid off, but they're looking for you to go to work every day and do your job, and you are stressed out. It's just not fair. It's not fair to any of us.
What do you have for
listening.
what do you have for PPE at your facility? You say you have a client who's been diagnosed, what do you have for PPE there? Do you have the N95 masks?
No, I was told they were on back order. I called one of the houses today to see if they got them yet. She said no, the only thing they had was, she said masks and gloves. But as far as the full PPE kit, no, we don't have those as of yet.
All right, well, thank you for speaking up. We're working like hell to try to get this administration to understand what's going on out there and take it seriously, but we're pushing. Thank you.
Thank you.
I think Claire is on the line. Is Claire there?
Yes, hello, can you hear me?
Yep.
Hello?
Go ahead.
Hi, my name is, first of all, thank you, Senator Murphy, for taking this time to speak with us. My name is Claire Martin. I'm a PCA from Middletown, Connecticut, and I've been a PCA for almost 15 years now. Since the pandemic struck, we have seen our world turned on its head, and overnight it became undeniable that PCAs do essential work that can't stop even when everything else grinds to a halt. It also has highlighted what a dire position essential workers are in when they are also low-wage earners on top of that. Ever since I've been a PCA, I have made below a living wage. I have no savings. I have never made enough money to live independently, let alone have savings in case of an emergency like now. We don't have guaranteed health care, even though we provide health care. We work to bring the quality of life to others, but we are not able to do the same for ourselves. PCAs often work 2 or 3 jobs just to support ourselves, and this is not how anybody should be treated, especially not workers who risk their health and make life and death calls every day. A living wage here in Connecticut is $20 an hour. Even with that, we desperately need health insurance built in. We need a career ladder for PCAs. Keep it in mind that we are skilled workers, and many of us have educational and professional credentials that currently have no bearing on our compensation. This crisis has shown just how important PCAs are to the fabric of our society, yet simultaneously, we are some of the least compensated. Once this crisis is over, I implore you that we cannot go back to business as usual for PCAs. We can't live under this system. The system is not set up to support essential workers. And as many of us have said, while it's nice to hear that we are essential and that we are heroes and how important we are, it's never demonstrated by giving us what we really need. We have to fight for every bit of PPE. We have to fight to keep our consumers afloat, to keep ourselves afloat. And we have been constantly trying to tread water even before this crisis has happened. So what I'm asking is that going forward, you consider just how important we are to you and to our society, and that we need to be compensated better. And the way we are treated, it needs to reflect what people have been saying about us being heroes. We need to see that. We need to see action. We need our lives to change as well, because we are also suffering. We are vulnerable people, just like our consumers and our clients are vulnerable. And we just can't rely on the system anymore. I really hope that if we take something from this, that we recognize who is really important in our society and just how much we are neglected despite that. Thank you for your attention, Steph.
No. Here. I couldn't say it any better myself. We've got a short-term job here, which is to, get some immediate compensation help to frontline workers. But you're pointing out the long-term project here, which is to make work pay and recognize that some of the most important work in this country is being done by people who show up every day to work full-time, work a second job, many times still don't have enough money to put food on the table. That's unacceptable in the richest, most affluent, most powerful country in the world during a crisis or during normal times.
I think we found Kat. and she's our last speaker, so if we could just trouble you for a couple more minutes, I know we're keeping you longer. Kat, are you there?
I am finally.
Good.
Thank you.
Good, thank you. Hey, Kat, go ahead.
Hi, how are you? So just to introduce myself, I'm Kat Nato. I am a GTW and also the Equipment Control Coordinator here at Connecticut Valley Hospital. 23 years, by the way. That being said, I think there's a myth that only clinical and medical staff have long exposure to these COVID-19 positive clients. My one coworker and I, there's just the two of us that do what we do. We've been working 7 days a week, and yesterday was 18 and a half hours. We've been averaging about 16 hours a day, probably since February, 7 days a week. So the long hours is just ridiculous. My coworker and I, we built the unit that was just to house our positive clients. And there's PPE is not a problem for us because, as you know, we are a hospital and it is readily available for us. For us, it's just having the long hours. As you know, there's one shift of us. There's not 3 shifts, where there is 3 shifts in clinical. So we don't get the relief. You know, if there's still something that needs to be done after our normal shift, obviously we have to stay to take care of that. Are you still there?
Yep,
I'm here.
we're here.
Okay, yeah, for some reason something's going on with the phone. So a couple of the things I wanted to bring up was, this is, something's going on with my phone, there we go.
We can hear you though, it's okay.
Okay, great, sorry. So I do know, I'm also a union steward. Our environmental services people were told that the gloves that they wear is adequate. It's extremely not adequate. They tear just picking up a pencil, let's say. They're just so thin. But the other gloves are too expensive. So of course the clinical staff is able to use those gloves. So it's becoming a situation where the housekeepers are really afraid. I'm not sure if it's I don't think that they're being paranoid because obviously there's cause for concern, but really I think that they are being underserved by not being provided with the necessary equipment to do their job safely. So the lack of funds is obviously a problem for us too. We have electric beds for these clients and we need more. There's a whole unit right now of positive clients and we are opening another unit and we don't have the electric beds for them. We were told that we don't have the funding for them. So it's quite scary for us because these clients, because it's a respiratory problem, they need to sit up. They need to be able to move and have the equipment necessary to stay, you know, to at least try to fight this and be healthy. So again, the high stress, the high fatigue, the high concern. As you know, Connecticut Valley, this is a very vulnerable class of people. So for us, it's just being here 18 hours a day, not being able to go home to our families. On a personal note, my son became a father yesterday for the first time. I can't congratulate him. I can't hug him. I don't know when I'm going to be able to see him or my grandkids because I'm so afraid that I'm going to take this, I'm going to carry this back to them. So I think it's a myth that only, again, clinical and medical staff have the long exposure. We're here, we're on the front lines every day, 7 days a week. And, you know, the staffing is a problem. We are so completely understaffed. It's becoming, dare I say, libelous at this point.
Yeah.
Thank you.
Well, I appreciate that. And we, as I mentioned, we are, you know, going to make sure that if we can get this legislation passed rewarding frontline workers, that we make that definition inclusive and that we recognize all the people who are putting their health on the line. And again, back to this point we were talking about earlier, you know, our healthcare system was already so fragile to begin with. We had stretched workers so thin with too many hours and not enough pay. my hope is that this becomes a broader wake-up call for my colleagues to listen to the kind of things that many of us have been fighting for and that SEIU has been fighting for a long time. This, we live in a world today in which we are dependent on billionaires to buy laptops for our kids so that they can learn at home. The net worth of people like Jeff Bezos and Bill Gates has increased during this crisis by $5 to $6 billion each. How do we live with ourselves if we don't fundamentally address this idea where families can lose a job and a week later be out of food? Well, during a crisis, a handful of Americans are literally increasing their net worth by $5 to $10 billion. Something stinks. And we've got to address the immediate crisis and the broader crisis as well. So Rick, thanks for including me on this today. And I look forward to following up with everybody.
Thank you very much, Senator. Keep fighting for us. We need you.
Thank you very much, everybody.
Stay healthy. So the senator left. I know there might be some questions from the press. If they're still on, if they want to ask, unmute yourself and go ahead.
Hi, can you hear me? This is Sabina from News Channel 8.
Yes.
I have a question. I think it specifically is referring to, I think, what Tanya was mentioning. Now, we heard from the state, we've been hearing from union members that there is a lack of PPE, but every time we ask the state about it, we hear that the nursing homes are reporting that they have enough PPE. So I wonder, that kind of references what your first speaker talked about with, she says the nurse manager had PPE, but the staff, the CNAs, maybe we're not getting it. Can you speak a little bit more to that and this disconnect that we're seeing?
Tanya, you want to go, and then maybe Rob will take it too. But go ahead, Tanya.
Yes, it's for facts. We were on the unit and we didn't have the gowns or the hats, and every day 2 boxes of a size large and a medium would come on each unit, on each shift. And we had to take enough gloves that most of the time, the gloves that we had to use for more than one residence. We had to come out of the rooms and we used the hand sanitizers to clean the gloves to move on to the next room. So once I began the fever and feeling kind of sick at that point, I really wanted to just leave and stay home. But I was working, so I went to my administrator, and we were having a screaming match at each other because I told her that I noticed that when the lab people or whoever else would come in, they would provide them with supplies to draw whatever their blood work or whatever. And for 5 seconds or a minute, whatever it took them to do the work that they do, they were provided with the supplies because they would not draw the blood if they didn't have it. So we got so frustrated that I went to the office and I was screaming at her like, I just don't want to die because you guys have the materials to give to the people coming in, but we who are on the unit all damn day would have to cover ourselves with plastic bags over our heads and over our uniforms just to have something to cover us while we go into the rooms. And at that moment, this woman, she opens the door to an office beside her office, and I stood there and all I could do was cry because This lady had everything in that office, boxes and boxes of supply, and she took one of the
Take it easy. Take it easy, Tanya. It's what they did to you was horrible. Rob, you want to jump in and address this issue?
Yeah, Tanya, thank you for sharing that story. Nobody should have to go through what you and hundreds of our members and hundreds of residents are going through in nursing homes across the state. In answer to the question, unfortunately, as recently as yesterday, we had workers at multiple facilities send us photos of themselves in trash bags, which is what is serving as personal protective equipment in skilled nursing facilities. Okay, the residents are not trash, the workers are not trash, but our federal government is treating the most at-risk people in our society like they're garbage. The people who are being asked to take every risk, to make every sacrifice, sacrificing their own personal health and going to work day in and day out, are being treated like trash by the President of the United States, who has not invoked the Defense Production Act to create hundreds of millions of units of personal protective equipment. If this workforce was not overwhelmingly female, not overwhelmingly Black, not overwhelmingly brown, he would not be treating them in that fashion. He treats these workers as if they are disposable. He treats our elderly as if they are disposable. Okay, the nursing home residents are overwhelmingly low income, and we are going to continue to tell the truth about what is taking place in skilled nursing facilities. And I'll just add that we've made some progress in terms of the state's leadership. There was a Medicaid rate increase, which will pay COVID-19 patients up to $400 a day in terms of the Medicaid rate. That unfortunately leaves urban nursing homes, again, majority Black, brown populations in terms of nursing home residents, with significantly less in terms of the funding increase than suburban, whiter, and wealthier nursing home populations. So unfortunately, we have a ways to go to deal with the racial justice and equity issues and the equity for all workers that we absolutely need to make sure that the COVID-19 response at all levels of government is just and is equitable.
And if I could just add one thing, at the onset of this call, I cautioned people not to curse, and I'm going to try real hard not to follow my own rule there. But we also have, for want of a better term, idiots out there in our state demanding that more and more people, like our members, get sick so they can go get a tattoo, or they can go get their hair cut, or other sort of trivial issues. And they don't understand or don't want to understand the tremendous toll that this takes on our members, their families, and the people they take care of. Anyways, any more questions? Deshaun, you have your hand up. Go ahead, I've unmuted you.
Yes. Can you hear me?
Yeah.
Yeah. I don't know if Miss Woods is still on the call, but I just want to rebut what she said a little bit about our hours getting cut, because I am a 32BJ member also, and I'm a security officer also. Anything, and I'm a leader in 32BJ, and my office got cut down to 15 hours a week. So anything under 30 hours per our contract, we lose our health benefits immediately. So if we get laid off, we keep our health benefits for 60 days. But if we get our hours cut, it's immediate. So I understand where she's coming from, and we are considered essential workers. Now, now if you cut our hours so much that we can't even get our health care, like she said, we can't go back to our families because like she said, her family is all underneath her health care. My wife's underneath my health care. Okay, I mean, we have families that now, I mean, forget about the pay for a minute. Okay, if we catch this, okay, we don't have adequate health care to even combat it. I mean, we're already the working poor already. I'm pretty sure nobody on this call is rich, okay? But we're already the working poor. And then on top of all that, okay, we're thousands of dollars in medical bills because now we have to go and have no insurance at all and combat this. So we're gonna have a hospital bill of tens of thousands of dollars because we have no health insurance. So that is a huge problem for a lot of us.
Thank you. Any other questions or comments? All set?
Yeah, hold on, Nick. Well, I want to speak about the home care workers and the lack of PPE that we have. The state so far has given us about 4,000 pieces of PPE, which covers about 5% of our 10,000 home care workers. And we're not getting what we need from the state. And all we're getting is lip service from the state and not no answers.
Okay, thanks, Norm. I think Gladys is on the call and wanted to say something. Gladys, are you there? Unmute yourself. Gladys Castro.
Yes, good afternoon. My name is Gladys Castro. I'm working at the Western Rehabilitation Care Center in Danbury.
Go ahead.
Everybody talking the COVID-19 is true. Everything we're talking and need is exactly, but have 13 days coronavirus positive, a high temperature. Today is 19 days in my home. Thank God my daughter helped me. She gave me care for me, but I live alone here. My question is, my friends, as 20 CNAs have a positive coronavirus because the equipment, only one give, I don't know, CC, this masker for 1 week using. It's not supposed. This is the people infect a contaminator. I don't know right now because it's 19 days I'm in home. The equipment's need, but maybe I'm okay right now. And then one day return, my question is, I know I a small person for cleaning, need cleaning this area, this nurses home need, please. Si no cleaning and no kill this virus little bit, they're not in service when using the equipment, for example, gloves, mask, etc. So I'm nervous for return. I don't know when because I'm not feel okay. I'm sorry, my second language is English, but because my first language is Spanish. But I have my daughter for interpreting. For me, see, maybe somebody no understand my English.
No, we can understand you fine. Go ahead.
Yes, this is, I thank you for giving me this opportunity for say help. No es only one nursing home, many nursing homes in the United States, especially Connecticut, especially Danbury. Somebody talking the helping, the government to helping money, everything, but my question, when is the help and the nurses home. When? Because it's true, talking, only one talking. Many times I listen. Many times the supervisor tell. Supervise no helping for nothing because have high people ordering. You know, everybody is employees, say, for example. And then sometimes no have opportunity for talking. Sometimes they're nervous. Sometimes, oh, maybe loses my job. But thank God, thank you, give me the opportunity for talking right now. I say I need no one Western rehabilitation, everything nurses home need, because it's poor imagination. Only one this is cheap. This is possible. No, this is nothing. I don't understand.
Thank you, Gladys. You raised a lot of good questions, and unfortunately, the answers are not good right now. Peter, I see you have your hand up. Peter Yankowski.
Yeah, hi. Peter Yankowski with Hearst Connecticut Media. Just a real quick question. I heard Rob gave new numbers on the number of workers who have died, and I know it's tragic, but I think if you could repeat those, I think your video skipped. I just think it's an important story for people to know right now.
You're on mute. Go ahead.
Sorry. Did you not hear my question earlier?
No. I heard you. Peter.
Oh, okay.
Go ahead, Rob.
I heard your question, yeah. To the best of our understanding, there are 375 residents that have passed, and 9 members of our union, including 4 nursing home workers that have passed. There are also a number of workers that are in intensive care, who we of course are praying pull through. And we had the first report on fatality of a family member of a nurse's aide who transmitted the virus to her mother, who did not make it.
And Local 32BJ also had 2 additional deaths as well from their members here in Connecticut. Alberto, you have your hand up. Do you want to talk again?
No.
Oh, okay. Never mind. Any other questions? Well, thank you very much for participating. Thank you all for taking the time. This is important. It's important for us to get our voices out. There's a lot of chatter and a lot of, I won't characterize it, but there's a lot of chatter out there, and it's important for us to get our message out. And all of your stories were incredibly powerful and incredibly meaningful. And if we hang together, we can get through this. You know, everybody doing their own thing or taking care of just themselves will just mean more pain and suffering for all of us. So I want to thank you all, and thank you for sharing your stories.
Thank you.
I think that's it. Thanks.
Thank you.
Thank you.
And thank you, Victor, for translating.
Yes.
Thank you.
Thank you.